Okay, so we are doing our nurse residency project on turn teams and seeing if can creating a turn team help reduce hospital acquired pressure injuries.
For this study, we looked at adults and specifically acute care patients with a Braden score of less than 18. And we asked ourselves, would implementing an official turn team as compared to the current practice of not having a turn team decrease the incidence of hospital-acquired pressure injuries?
So the problem is that our patients are still getting hospital-acquired pressure injuries with the current policy that we have in place. That policy is that the nurse caring for the patient comes up with a plan with her care team, that being another nurse or maybe a tech, to turn that patient every 2 hours. And the reason it's not working is we have a lot of tasks that we're trying to keep up with, and we have multiple patients that need turned at different times. And so a lot of times those tasks can get lost and we're not doing those turns every 2 hours. We just simply can't be in all those places at once. So the first article, this one talks about nurse implementation and preventing pressure injuries. So some of the nurse implementations are skin assessment on arrival and determining that Braden scale. If a patient is found to be at risk, for example, they are bedbound, or they already have skin wounds, or their Braden scale is less than 18, then they need to be turned. So this article found that nurses and working together on a turn team schedule decreased the amount of pressure injuries and the length of stay for patients. So the average length of stay was decreased, but also in 12 months, the amount of pressure injuries was reduced by 54%.
So Article 2, this was done in an ICU setting during the COVID-19 pandemic. Essentially, they utilized a turn team to prone position a large number of patients, and the turn team consisted of ICU trained physical therapists and occupational therapists, along with the RN that would kind of lead the team. And pretty much any time wide needed a patient reposition, they do the repositioning. And so they found that this was safe, effective, very attainable, achievable. They didn't have any complications with dislodged. And then there was only one pressure injury recorded where they actually happened on the anterior side from this prone positioning. But otherwise, the article is in full support of this being definitely achievable and effective for something maybe we could put into practice at some point.
Article 3 looked at cases of patients in a healthcare setting, and they compared turn teams as against hospitals that did not practice turn teams. And then in their study, they realized that the hospitals that practice turn teams or that reposition their patients frequently every 2 to 3 hours had less incidence of pressure injury. The study also showed that the nurses and staff were prone to less injury. Patients reported comfort, and they had very little cases of pressure injury. It actually said that it showed a 51% reduction in the odds of having a pressure injury when you use turn teams as against not using a turn team.
Article 4, reducing pressure injury incidence using a turn team assignment. The purpose of the study was to look at the outcomes of the quality improvement project that evaluated a turning intervention for prevention of facility-acquired pressure injuries. This was a descriptive correlation study, and it just examined the effectiveness of using a turn team assignment. The study was just composed of RNs and NAs, and it looked at patients that were admitted and then followed them each subsequent day of their hospitalization. And it took place in a surgical intensive care unit in a Midwest inner city teaching hospital. The study was done by direct observation and occurred in 2-hour increments over a 14-day period. And they used an 11-item unit designed process improvement tool. So they collected information regarding queuing, concurrent turning, independent turning instead of using queues, staff support, and possible barriers to turning and repositioning. And then after the study was completed, they also looked at the staff perceptions. They collected those by using an online survey, and just whether they felt like the interventions were effective. So the 12 months prior to this being put in place, their pressure injury occurrences were at 24.9%. And after the study was put into place, they declined to 16.8%. So there was a strong positive correlation between verbal cueing and turning. And then the staff perceptions were also supported pre-intervention education and cueing as effective interventions in completing patient turning. So they felt that like it didn't take any increase in personnel. So they felt like this would be an effective plan to put in place to decrease the pressure injury occurrences in hospitals.
So based on the research that we did, these articles and others, we decided that turn teams should be implemented in our healthcare system as it showed improved compliance with frequent repositioning on the part of staff, as well as improving patient outcomes by not having these hospital-acquired pressure injuries, and then ultimately reduces the cost overall for the entire hospital system by not having to treat new pressure injuries in patients if they were to occur while they were in our hospital. If there are any questions based on our study, here's all of our contact information. And finally, our references.